Well, market timing is everything. As the Accountable Care Act is forcing changes in the reimbursement system across the country, and our reimbursement system is going from a fee-for-service reimbursement system to a value-based purchase system. You need access points, and you need to align your resources for the community, to take care of the community in the most appropriate ways. We think the market timing is appropriate for right now for us to expand a whole ambulatory strategy, of which urgent care is just one of many. And we see tremendous synergy having primary care and urgent care located in the same location as we do in Northfield. And we see many people in our community that actually do not have primary care physicians. And the urgent care is a way to provide patient access in the evenings and weekends when it may not be possible, even if you do have a primary care physician, to get into an office and get care in a timely way. Well, you're absolutely right. Certain patients have primary care physicians already, but in many cases they have limited hours. They have hours Monday through Friday, and this, we believe, if somebody has a primary care physician, this offers an access point for something that can be taken care of quickly. An earache, a stomach ache, a child gets off the bus at 3:30 and is feeling punky, and you really don't want to wait until the next day, can't get an appointment that quick, and it offers access for that type of patient. For patients that don't have primary care, this may be one of the only outlets that they have. And it's an affordable option, especially now as you watch the insurance premiums having huge copays, huge deductibles, as we all are trying to contain the cost of healthcare. And this offers a very affordable outlet for people with those types of insurances. Well, I think the patients that will use this site, again, are patients like child age school children that get off the bus and feel punky and don't want to wait until the next day. I think you have a lot of people in this marketplace with chronic diseases such as diabetes, coronary artery disease, and again, this may be a way for them to get treatment in an urgent manner, in an unscheduled manner when they need something like that. If they do have primary care physician, urgent care can take care of the patient and make sure they get back to the primary care physician with full documentation of what's happened and transpired, and I think that offers the community some great alternatives. The synergy of having urgent care and primary care at Northfield is that if a patient doesn't have a primary care physician, we can quickly get them one for continuity of care long term. And I think more and more, as the Accountable Care Act gets more and more traction and the reimbursement system starts to flip, you'll hear the catchphrase, collaboration of care, coordination of care across the continuum, and that's going to be much more important than ever. So how the handoffs are given back and forth between urgent care, primary care, et cetera, are going to be dramatically different. One of the things that's a huge discriminator at our Northfield site is our approach to technology. And that, for us, means that an electronic health record for all Sure Physician Group members and urgent care, it's the same exact tool. And then we have other tools that are allowing us to look at data, quality data, cost data, and constantly improve our care. And that's one of the things that I think is certainly distinctive. The other is that Sure Physician Group is part of an advanced medical home project. And the coordination of care and the measures of quality and the efficiencies that are being put in place with the payers are very, very positive, I think, for this community and improving the care that all physicians are giving across the country. Well, I think one of the hopes of the Accountable Care Act is that there's more insured patients. There are certainly several issues in the state of New Jersey, for instance, the expansion of Medicaid that will provide or not additional access for certain parts of our communities. So I don't know if we're going to see a huge influx of insured patients. That's my hope. But this model that we've put in place clearly is an affordable alternative that provides high quality care for those patients, again, that have high deductible plans, high co-pays, and an access point. Urgent care by itself is only an access point. It's the coordination of care, the continuum of care, the handoffs, and how we're measuring our clinical performance that's going to be tremendously important. And I think that's important not only to Shore, but hospitals across the country. Well, the technology we speak of really is about managing the data and the coordination of care. That's the pure magic. But like many other well-equipped sites, we have access to radiology that can be read remotely with overreads by radiologists. We have all the diagnostic and lab tools that are appropriate for that venue. And then with the physicians being co-located, we have a multidisciplinary group. It's primary care, it's general surgery, it's gynecology, it's many disciplines in that one space. And there are procedures that are performed by the general surgeons and certainly some other plastics types procedures that can be done in the office space. Yeah, absolutely. All the physicians, both in urgent care and in the Shore Physician Group sites, have full access to all of the data that the hospital has, including historical radiology images through something called a PACS system. They have, we have an acute care or a hospital-based electronic health record here that the physicians can log in and see what the last episode was in the hospital. But inside of the practices of Shore Physician Group and urgent care, what we have is the same electronic health record. So we can pull data about the variation of practice. What's the best practice for treating certain chronic diseases? How do you best manage a diabetic patient or coronary artery disease patient or congestive heart failure patient? And what we envision is the technology, the healthcare technology of imaging and lab and procedures is there as expected, but the power is truly in managing the data and providing better and better quality of care, reduce the variation of practice, have evidence-based medicine in place. And I think the huge discriminator for us is we've empowered physicians as leaders. And they are making decisions about clinical care. They're making decisions about medical home. And they're participating as this reimbursement system flips to a value-based purchasing system. The shared cost savings, ultimately, that the medical home and other vehicles like that will allow us to share the fiscal benefit of the reduced cost with the physicians. But physician leaders are absolutely a critical key to all of us for changing healthcare and making it more efficient. Well, right now in the hospital, a huge portion of our volume as the baby boomers age is the Medicare population. We also, as Shore Physician Group, have certain sites that are receiving Medicaid patients. So we're trying to support our community as best we can. We, in the last several years, have hovered around $20 to $22 million of uncompensated care that we deliver every year out of the $200 million that we collect in our revenue. So we are working in every way to make our operation as efficient as possible. Data-driven, physician-led initiatives are absolutely key. There's a group of 13 physician leaders that offer advice to myself and the balance of the senior team. And I think tapping into that knowledge is incredibly powerful because the doctors really know how to make this whole system more efficient. We've done some fairly innovative things in the community. I don't want to stray too far from this topic, but pediatric units were closing all over the country, or all over the state. And we looked across the country and found a sample of something called a hybrid unit, where you basically put something next to your emergency room, close your inpatient peds unit, and allow those beds to flex for the treat and release from the emergency room to the inpatient admits. And it's initiatives like that that are innovative ways to control costs, still providing a very high quality product to the community that we serve, and continue to build efficiencies. Yeah, the urgent care in Northfield is really only one portion of a fairly robust ambulatory strategy for us. We believe the market timing is wholly appropriate as we approach the flip in the reimbursement system from a volume-based reimbursement to a value-based reimbursement. And like I said, urgent care is one component. You see Sure Physician Group. I think you see an ambulatory strategy, an ambulatory presence that is going to become more and more robust over time. Urgent care is one piece. Sure Physician Group is another piece. Sure Physician Group at the end of 2012 was 20 physicians. I believe we're going to be 45 by the end of this calendar year. Within 3 years, we're going to be 75 or 80 physicians. And I think that's going to provide the ambulatory footprint along with urgent care. And this summer, I don't want to get too far ahead of ourselves, but we're going to start rolling out some very innovative care models this summer that augment this strategy. And I think that's if you want to talk about the possible future of healthcare, it could very well be a robust ambulatory strategy driven by physician leaders that has an acute care hospital in this integrated delivery system for the very ill, highly acute patients that need surgery and ICU and emergency room. And I think understanding that there are different levels as patients and families make healthcare choices with their high deductible, high copay plans, they're going to be making economic choices and aligning our resources and stewarding the resources that we're given by the community to allocate appropriately. I think that's going to be the key, getting the right resource to take care of patients in the right level of care in the right venue. Well, I can only speak for our Sure. I think every healthcare system, however, in the country is making decisions about timing the market. We believe we've timed our urgent care presence and our ambulatory strategy, of which urgent care is only one component, very well. And we're positioning that in the marketplace. If you start to think about 2014 being the first trigger, if you will, to the whole Accountable Care Act and kind of watching and pacing towards that, we believe our timing in the marketplace is very well positioned to not only serve the community, but also continue to help us be a long-term, sustainable, vibrant organization. Well, I do think that part of the Accountable Care Act is forcing all health systems to start to look at managing their quality data, managing their cost data in very different ways. And I think people who are able to gather that information and gather that data and turn it into information for clinical decisions and business decisions are going to be the winners in the marketplace. So I do believe that part of the byproduct of all of this change in healthcare and the chaos that we're currently going through, nobody has a crystal ball for the future, but I do believe that a data-driven organization is what the government is asking us to be more and more, and that's going to lead to better health, better public health. I think also how employers drive much of this, because a lot of times the employer helps focus individuals on their own ownership of their health issues and maybe providing discounts to healthcare if they work out or if they stop smoking or if they do things like that. So I think depending on how assertive employers are in the marketplace, I think that's going to help some of this change in healthcare. But I do believe that the end result will be a better quality of care and a healthier. Like I said, right now, Sure Physician Group has 20 physicians at the end of 2012. I believe we're going to be 45 at the end of this year and 75 to 80 physicians at the 3-year mark. We have a handful of locations, but we are looking at 5 other locations in the area, some of which will have urgent care and primary care in the same area. As far as the specialties, because we absolutely believe, and we've put a governance structure in place that is physician-led on these issues, the physicians in Sure Physician Group and in partnership with the urgent care sites are going to decide when and how many of what specialties to add. Right now we have everything from plastics and reconstruction to gynecology to general surgery to primary care to family practice. We have worked in January alone, we've signed 7 physicians in the first month of the 2013 year. So I think what you're going to see is a physician-led expansion that makes sense based on the specialties that they need and discuss amongst their colleagues.